the potential role of systems such as openIMS in achieving universal health coverage in the Philippines. So let me begin with saying that um, it's starting with what universal health coverage is. Universal health coverage is defined by WHO to be at least composed of these elements. It's related to all people and communities in whatever setting it is. It pertains to promotive, preventive, curative, rehabilitative, and palliative health services. So across all ranges of the healthcare services that health systems can and will provide, and this has to be of sufficient quality to qualify as a service that's being provided under universal health coverage. It also pertains to providing these services whenever and wherever needed. So it's not just a system wherein services are being provided where left and right. It has to be service that has been identified as a need, um, whereas need is being defined as uh, capacity to benefit. So meaning the services should have um, a demonstrable benefit to the people and communities that it will be given to. It also, I think, this is probably one of the key um, descriptions of what universal health coverage is aside from covering the people, aside from providing the range of services, aside from providing the services whenever and wherever needed, a crucial element of universal health coverage is that it protects the people and communities from financial hardship just due to um, health services. So this concept of universal health coverage is being pushed in all health systems globally, and that various levels of attainment is being monitored regularly. The basis for universal health coverage is actually um, dictated or being mandated from global health declarations from over half a century ago, from the WHO declaration saying that health is a human right, and in the 1978 Alma Ata Declaration saying that health is something that is for all. So having said that, universal health coverage is a continuous um, goal that health systems should achieve, especially systems that are members of the United Nations. To aid health systems in framing health goals, they have devised a health system strengthening framework. The framework describes what are the building blocks or the necessary elements that health systems can make action on to achieve the final overall goals and outcomes. And these are actually improved health, health system responsiveness, social and financial risk protection, and improved efficiency. Now, uh, in order to achieve these overall outcomes and goals, there has to be ways of intermediate um, outcomes that needs to be attained, such as access, coverage, quality, and safety. Now, um, going back to the building blocks, so there are six building blocks described in the health systems framework. All of these have been identified as necessary action elements or action points for to in our in settings may have various levels um, of sets of challenges, of resource per each of the six building blocks. We now can relate the six building blocks to the overall effort of what our systems may be doing. So openIMIS or openIMIS is one tool that can be used to help some of the challenges being encountered in each of these 6 building blocks. We can go back to this health systems framework, and at least we can identify a few that are highly relevant to our presentation today. The two of which are health information systems and health financing. So we'll go to each of these main blocks of concern, and um, how these are linked in achieving universal health coverage. Health systems, or a well-functioning health information system, has been deemed to be an important part or component of achieving UHC. Um, Part of the reasons why is this so is that the other building blocks may depend on some to some extent on well-functioning health information systems. Health information systems would have to ensure and reliable information that is being exchanged across various levels and sectors of health system governance. Among the relevant questions that how a well-functioning systems can ensure is uh, are answers to questions such as, are people getting services? A well-functioning information system can and at will provide the proper digits, the proper number, proper statistics needed to identify and to quantify needed per population area and at that specific time and place. Health information systems should um, also be able to ensure that uh, the national strategies and plans are based on usable, accurate, timely, and reliable data. In order to monitor if we are achieving the goals that health systems um, have aimed to achieve or targets, we need to be able to monitor if we are achieving progress. So a health information system, a well-functioning one, can provide accurate data on this. And this is important because we would have to see if all our efforts are enough. Um, are we achieving the intermediate and final outcome that we aim to do? We also need to ensure that during emergencies and disaster, we have because these are crucial and time-sensitive events. A well-functioning health information system can provide what funder decision makers um should act on at a fast environment, especially during emergencies and disasters. Last and probably not, of course, not the least, health information systems can also provide us if the commitments that our leaders have given and on any stage um, of their leadership. How do we make them accountable for all their promises, for all their mandates? And so you need some form of metrics for you to say that this leader has achieved what the goals are, or this leader has not been able to deliver the promises that's given at the start. So that's some of the many ways that health information and information systems can help us achieve universal health coverage. Now we also try to link health financing as one core element of strengthening our core building block of strengthening health systems. Um, we can start with saying that health financing is the um, function of the health system that enable progress towards UHC by improving effective service coverage and financial protection. So usually, health financing uh, is described as having four core functions, including revenue generation, risk pooling, strategic purchasing, and benefit development. It will be prudent to know that each of these core functions of UHC rely on timely, complete, and accurate information, such that planning and financing for health programs, policies, and other interventions uh, in any health system rely on information. For example, information on how much potential revenue can be generated from contributors of a social health insurance. A timely and complete and accurate information is needed because um, the other sources of funding can potentially not be enough if miscalculations of potential revenues from various sources is done. We also have to have appropriate and accurate information about the risks, the total risks that health systems have in terms of populations and subpopulations. Uh, Governments are being allowed uh, to make strategies on how to minimize risks for everyone, and that entails accurate and timely information. In order to, in the same way, in order to for health systems to make strategic purchasing as well as benefits. Sorry about that. I think I need to. Can I pause for a bit? So going back, I was just saying that in order for health systems to make appropriate strategies in purchasing healthcare services and to develop health benefits to its contributors strategically, health information that is complete, that can encompass the that can encompass these populations and subpopulations being targeted. Health information systems are should be in place. A well-functioning health information system can also be described to have the following basic characteristics. It should be able to generate data at various levels, such as individual level, meaning patient level data, facilities. It should be able to generate and aggregate data from each physical facility in a health system. Also, it should be able to generate population level data, especially for, and this is especially important in making national level and subnational level health planning and financing. Also, it should be able to collect, uh, analyze, and use data that's coming from various sources, such as public health surveillance platforms, medical records of individual patients, civil registration, surveys, censuses, as well as health human resources and infrastructure and financing. So each of these potential sources of health data, a well-functioning health system should be able to collect, gather, and analyze data and use data from various sources. And in addition, the data that has to that is or information that is to be available should be on time. There is an on-demand capacity to detect, investigate, communicate, and contain events that pose risks to individual and population health. In addition, a well-functioning health information system, should have the capacity to apply and use synthesized information to protect and improve health, including in areas of clinical management, financing, planning, and implementation. So I'm just describing what WHO describes as a well-functioning health information system. Now, of course, not all health systems have health information systems perfectly. So these elements are challenges that health systems have at varying levels and degrees. So there's incomplete and poor data. There may be duplication and fragmentation of data across reporting systems. There may be problems linking resources, investments to results and outcome, and this is very crucial in assuring accountability and governance. And there's also ever-changing needs and demands because there's needs and demands of health on health of populations are changing every time. There's also problems wherein late synthesis and use of data is happening, and there may be complete they may be complete accurate information, but if this information are late, then they still pose some challenges. Um, we also recognize that populations are heterogeneous, so solutions that work in one particular health system may not be able to address challenges encountered in another. So there's also problems of insufficient cooperation between sectors and agencies, or not too or not some agencies are not too involved in health information systems. Finally, probably especially in low income countries, there's slow and non-adoption of ICT tools such as openIMIS, or there is an inconsistent and incomplete application, limiting its potential. So at the background of this, some challenges can be actually addressed, and there are various guidelines that WHO has provided in terms of how to address these challenges. There's challenges that improve challenges that can be solved if we improve governance, which enables environment and robust collaboration across all involved sectors. There should be enough investments in technology, tools, and capacities, and an open source tool such as openIMIS is a ready tool that health systems can actually use to um, um, aid them in addressing some of the challenges identified earlier. There needs to be an alignment of important and key stakeholders in support of instituting a well-functioning health information system. Aside from these, it's a common move across health systems to go digital. That this this move improves availability, completeness, timeliness, and quality of the health information being used. And finally, um, to address lateness of data or untimely use of data, um, health systems and all its elements should be able to use data as soon as possible. It's important in delivering individual and population level interventions, and this system should be able to link accountability of leaders with the results, and by establishing guidelines and frameworks by which this accountability can be measured. So, of, of course, Open IMIS is something that everyone is very familiar with. But going back to how it is being introduced to those who don't know, Open IMIS is a first and only open source software that can link provider, payer, and patient information. This may be actually still maybe a limited definition, because at the same time, um, health systems leaders can also um, make use of decision makers can make use of provider, payer, and patient information in a way that can help them address challenges in regarding inequities in health, for example, and access. Open IMIS is one of the many tools that can be used to aid health systems, but of course, it can help in the collection, administration, and monitoring of key health financing information, as well as non financing information. And It can create a transparency because it's especially if it's being used across many sectors and levels of health systems. It can also aid in increasing efficiency because it's used as an electronic platform of exchanging information. It can also provide service utilization and data across various areas, geopolitical and service areas and levels. So maybe just providing a diagram on how openIMIS can help in addressing some of the challenges identified earlier. There has to be an improvement of governance first, and improvement of governance means um, ability and willingness of health systems to use whatever available technology and tools are there. And OpenIMS IMIS is something that's already being used in a few health systems, and it has been initiated in some areas in the African continent, as well as in Nepal here in Asia. OpenIMIS can help um, health systems realize that some of the challenges identified can actually be solved using features of OpenIMIS. So going into specific health systems, such as the health system of the Philippines, in 10 years ago, we have had a document uh, describing how our health system is, and one of the chapters in that involves describing the health information system of the Philippines. It was said that the health information system of the Philippines reflects the entire health system in that it is fully integrated, it's weakly governed, and it leads to information gaps. And thus, the strategies and the interventions that government and non-government actors are doing may not be the exact strategies or interventions that the population and the country needs. For a long time, there has been no standards um, of of um of health systems and this precludes scaling up and interoperability of systems. In fact, this time um, there's still competing systems that are being tested and implemented, and one of the significant agencies of health, our social health insurance agency. It has the largest clinical database. However, at the same time, the claims processing is still mostly physical. There has been movement to move into digital, but a lot of the processes within the social health insurance is not yet digitalized, and so it may take 2 months, 3 months for a specific medical claim to be processed, and that entails a lot of opportunities lost. Um, in 2011, through that document, there has been a framework such as the Philippine Health Information Exchange. It was envisioned to become a platform for health data exchange, and there has been some progress in trying to achieve this. However, there's the priority of governments have barely touched on elements of achieving this health information exchange um, platform or framework. As you can see, this is another enterprise architecture proposed even 10 years ago. So this only demonstrates that the idea of having these multiple layers of that interface between users, services, applications, and other components and actors, institutions within the health system. These are actually have already been identified and mapped out even 10 years before in the Philippines. And the only problem is that how to operationalize having this specific or achieving certain elements of this specific enterprise architecture. One of the answers on how to operationalize this is provide a or introduce a system that can at least touch some of the necessary elements of this architecture. And so we're lucky that we have a very recent law, the Universal Health Coverage Law in the Philippines, and that the implementing rules and regulations of this law mandates that uh, service providers should maintain a health information system that includes enterprise resource planning, human resource information system, electronic health records, as well as health commodities and logistics management. The law implementing rules and regulations also dictate that the health information system should be interoperable with standards set by Department of Health, PhilHealth, which is the Social Health Insurance Agency, in coordination with the ICT Department and the National Privacy Commission. And the standards that should be set should allow evolution of system based on needs. This should also comply with Data Privacy Act. So examining these specific provisions of our law here in the Philippines, we can at least in some ways um, think of how systems such as openIMIS can help in achieving or at least addressing or going for the mandates dictated by the law. Um, the features of openIMIS make it an ideal solution to several components of challenges in the Philippines. First, it's an open source software. It means it can be a modular software. It's a modifiable software, and it can be designed to work based on the needs, specific needs of health systems where it will be implemented. OpenIMS is something. It's a system that also has been demonstrated to work. Um, in Nepal, it's being used. I think it's in Democratic Republic of Congo is being used as well. Um, I think in Cameroon as well it's being used, and that this has been shown to have demonstrable positive effect in health systems, health information systems of those specific countries. Um, Concerns about interoperability can be also addressed through because of the open nature, open source nature of OpenIMIS. And finally, the UHC law mandates are congruent with the openIMIS objectives in that says openIMIS is may improve health financing operations by offering a seamless exchange of data related to patients, health service providers, and payers for healthcare. So these are necessary, important elements that, to some extent, has also been described within the provisions of universal healthcare coverage law in the Philippines. I would also like to add here, this is a slide coming from Dr. Marcelo's presentation 2 days ago, and that there's the Mind the Gaps framework in that for health information systems to be successful and functional, the governments are advised to establish clear multi-sectoral governance structure for decision making. There should be an architecture, what's like what's being described earlier. There should also be focus and focus on program management, and finally there should be standards for interoperability. And again, this still parallels some of the general provisions of health information system strengthening described in WHO. I think that that's the end of my slide. I would like to end with the note that openIMIS is not and should not be a magic bullet, but it can spur achievement of it can spur the achievement of health systems goals if we have at least cemented all the necessary steps that's needed that corresponds to the health information systems building block of the WHO health system strengthening framework. So thank you. That I think that's the end of my presentation. I'd like to open the webinar for questions and comments.
Yes, thank you, Dr. DS. We have our first question. It reads, who are the relevant stakeholders needed to align around effective delivery of UHC in the Philippines?
Hello. So I think we can go back to the slide provisions, specific provisions. At least this one is dictated by the law itself. So the identified stakeholders are Department of Health, PhilHealth, in coordination with the TICT or Department of Information and Communications Technology, National Privacy Commissions. These are the core national agencies that should be involved. However, this should not be limited to these agencies. The private sector should also be involved. International collaborators should be involved. openIMIS can be a player, a key important player in this um, health information systems reform. So that's my I think who should be involved. But it's a multi-sectoral approach, and that these four national government agencies should spearhead the discussions revolving um, um, health information systems in the Philippines.
Thank you, Dr. DS. I think this is a follow-up question. It's
Mhm.
related to the first one. Is it just PhilHealth stakeholders?
So this national government agencies, of course, are mandated by the government to spearhead. But um, aside from PhilHealth, all the other players or payers, such as the private health insurance, can also participate. Um, the National Health Insurance Program um, is being posed as a key program for reducing financial risks out of health and medical care, but they should not be the only agencies involved. So private health insurance should be involved. Um, Other fund pooling and the benefits agencies should also be involved, and of course researchers and implementers of systems such as openIMIS should also participate in this discussion.
Thank you, Dr. DS. Our next question, Dr. DS, what are the risks of openIMIS and how do you see managing these?
Maybe risks in implementation is that because it's still a new platform, and that not many um, implementers are used to using an open source and interlinked system, interlinked systems such as openIMS. There may be um, some time um, some time for users to get used to using the system, while there may be risks as well in terms of data privacy, because systems such as this allow sharing of data and information between many relevant potential users of data. There are risks about appropriate use of data, but then again, um, health systems should also consider data privacy and confidentiality in in designing and devising um, and implementing systems such as openIMIS.
Thank you, Dr. DS. We have another question. So, what types of standards are followed to make openIMIS interoperable with other existing systems for health data exchange?
This is something that I wish I could answer, but maybe Dr. Marcelo can answer this. But unfortunately, I'm not very familiar with the standards being followed. I think this has been presented previously by and or many times by Dr. Marcelo. But if Dr. Alvin can answer this.
Hi all, this is Carl. I hope you can hear me. So do you mind just repeating the question so I can get that clearly?
Question is, what types of standards are followed to make openIMIS interoperable with other existing systems for health data exchange?
Thank you. So we are just finishing working up a project where openIMIS is exchanging data using the FHIR data standard. At the moment, we have finished projects where openIMIS is able to submit claims data, receive claims data that has been submitted from the BUMNI system, as well as being able to share data to DHIS2 to do aggregate data exchanges. Patterns are following the openHIE architecture and also work through the interoperability layer such as the openHIM. I hope that answers the question. And if anybody is more interested in that, there is a developers community and implementers community that is accessible through the openIMIS website.
Thank you, Sir Carl. We have another question, Dr. DS. So, what is the status of the implementation or adoption of openIMIS here in the Philippines? Yes, Dr. DS, I have Christine here with me to answer
Okay,
the
yeah,
question.
maybe I can ask Christine to answer this questions.
Hello. This is Christine from AeHIN. So we're creating an open IMIS community of practice in Asia. In the Philippines, we're starting the implementation here by building awareness and open IMIS. So what we're trying to do first is we partner with medical schools such as UP Manila, St. Luke's, and Athenaeum Medical School, and we try to organize training of trainers workshop with them. So we package the Open IMIS workshop as a health financing training. Over. I hope this clarifies this question. Thank you.
So I think I can add something more to that. So we're starting with a few universities. We're aiming to involve more universities in this training of introducing openIMIS. The idea behind that is that in the near future, like in 5 or 10 years, the same medical students that we are training right now will be the ones who are going to implement a system such as openIMIS. I think based on my conversation with Dr. Marcelo, that's the main idea, because some um, the current generation health practitioners may not be very open to that. However, this does not limit us from reaching out to them. It's just that I think as early as now, the medical students, if we can reach them and introduce openIMIS to them, then we could have a better chance of integrating openIMIS later on in the next generation.
Thank you, Dr. DS. Our next question is, how do you deal with data privacy in contexts where systems are linked to each other and exchanging information, especially that is private?
I think this is a very specific for the designing softwares. Um, my short answer is that we can use algorithms by which um, we can ensure that only the relevant and approved data are accessible to very specific people. And the main design of a system such as openIMIS can actually dictate and ensure data privacy. However, of course it has to be tailor fit, specific to each country. There are various different laws within each country, and that the specific design should be dictated by what the pertinent rules and regulations are in each health system.
We have another question. Our participant is asking how many countries globally are using openIMIS currently. And I think Sir Siddharth can help us answer this question.
So at this stage, I think the number is 6. There is a major implementation in Nepal, Tanzania is using it, and Cameroon, and there are pilots that are being reviewed in Chad, as well as 2 or 3 other African countries. The full details can be seen on the Global Digital Health presentation that was given in Washington, D.C. at the end of last year.
Thank you for that, for your help, Car, and yeah, for the answer.
Yes, thank you, Sir Carl and Dr. Diaz.
Thank you, everyone. There's one question here. They're asking if the presentation can be provided later on. So yeah, we will be able to share the slides. We provide a soft copy of the presentation. Can we just answer one last? Among the
Alright.
5 countries, which is the most advanced in implementation of openIMIS? Can somebody answer that
Sure.
specific?
The most advanced implementation is Nepal. They have processed probably over $7 million worth of claims running through it. And then following that would be the derivative in Tanzania.
Thank you for helping me with that question. Can we just answer one more? I think this has been asked twice. Can you provide some information on the timeline that has taken to implement openIMIS in the Philippines? And could you provide information to what extent openIMIS has been scaled up in the Philippines? So we can partly answer that. Right now, we are developing a community of practice, and we are trying to introduce a system to a limited number of institutions, mainly universities and among medical students. So that's about the extent of implementation of openIMIS. It's not yet a wide-scale implementation, but that is where we're trying to what we're trying to achieve. So we plan to reach out to all other medical schools in the Philippines within the next few months.
Yes, thank you very much, Dr. Diaz. I think that's the very last question.
So thank you everyone for listening, and hopefully see you again in the next webinars. So thank you.
Yes, thank you everyone. Bye.
Bye.